Alrighty, hi everyone, this is Dr. Holland Englert with Campbell Chiropractic, and this is Dr. Campbell, my willing patient. So today we're going to be discussing medial epicondylitis, which is also known as golfer's elbow, and we've had a couple patients come in and say that they were having elbow pain and were wondering what we could do for it. So what I'm going to show you is how we would treat the soft tissue part of it using voodoo floss, and then we'll go ahead and we'll tape it afterwards using the kinesio tape. So what I'm going to have you do is go ahead and just straighten out your elbows, that way we can see the full extension that you have on it. And then go ahead and bend all the way. So that way you guys have kind of can see his range of motion before we start. So what I'm going to have you do is go ahead and just stick your elbow out like this. And so using this voodoo floss, what it does is it creates compression within all of this soft tissue through here, so that forces the muscles, the tendons, all to rub against each other and break up those adhesions that they have. What it also does is it constricts all the blood flow through here, so we wrap it from distal to proximal. So we're pushing all of the blood, all of the lactic acid, all of that crap that gets stuck inside the joint, we're pushing that up towards the body so that way it can get through the lymphatic system and get flushed out through the rest of the body. So we're going to start just a little bit below the elbow, and this is going to be pretty tight. So we're just going to overlap slightly, about half of the band, all the way up. And so for this first round, we start off and it is tight, but it's not supposed to be painful. It'll be uncomfortable for sure, but we don't want any pain to the point where you can't continue. So now for this one, I'm just going to hold it. And so what I want you to do is go ahead and just bend your elbow up all the way and curl your wrist in. And then when you extend, I want you to flip your wrist out and extend it back as far as you can. So just go ahead and pump that 4 or 5 times. Now when we do this in the office, it will be closer to 1 minute to 2 minutes doing this with this band on, but for the sake of everybody watching, we're not going to sit and make you watch that. Alright, so go ahead and do. So now when we're done, we'll go and we'll just release the band. And so that quick release will help return all the blood flow to the rest of his limbs. So I don't know if you guys can see that, but his hand is red, so that's, all the blood isn't reaching that spot, and then it'll slowly get worked back in. So then go ahead and just move that through a range of motion again. Any comments on how it's feeling with just the one?
Well, the first time when we did it, I have pain right at the back end of my elbow, and it was a lot more intense. There's still a little bit there, but I have to really push a long ways to feel it now, where before it was all through the back of the elbow there. And then this way, it actually doesn't bother me at all.
Perfect. All right, so then we're going to do this a second time, and I'm not going to roll this up because it's pain, but we're going to do this a second time, and this is going to be much, much tighter than it was the first time because he can handle it.
Hey, he already bruised me.
And so this voodoo floss can go onto any extremity portion of your body. So we can get it all the way up into the bicep, close to the shoulder. We can do knees into hamstrings, but anything regarding the trunk, the neck, anything like that, it's not going to go on there.
You ever put it on people's neck?
It does have one of those little warnings on there. Go ahead and bend your elbow. Has one of those, warnings that they put on there. Do not wrap this around your neck, just in case people try. One more.
See my little fat globules on my arm right there. Jeez.
And now we're starting to get the
Discoloration.
Yep.
Look at that one. Look at all that blood.
Alright, so go ahead and work that through. Alright, so go ahead and stretch your elbow out this way so that way you can see.
What's really good?
Your extension.
My arm's straight.
That and all of the blood vessels popping out there. Alright, Okay, so now that we've gone and stretched out the muscles, the tendons, and we've got a little bit more range of motion in there, what we're going to do is we're going to use the kinesio tape, so that way it takes a little break off of all of those muscles that we just worked and gives them a little bit of a reprieve from working. So to start, I'm going to have you go ahead and just bend your elbow. And again, all of the colors that I use is just so that way you guys can see the different tape overlapping. All the colors work the same way. So we're going to start here, just above where the elbow, the point of the elbow is, so it's going to go right above that onto that tendon. And so then we're going to stretch this out, and then what I want you to do is go ahead and extend your elbow. And so this is going to wrap around across and go into the middle of the forearm. So this last bit, we don't put any stretch on it, so that way it sticks to the skin. Alright, so then with this piece of tape, it's covering the top portion of where those tendons cross over. And then for the second portion here, we're just going to put a strip here, so that way that creates a little bit of lift, a little bit of give on where the rest of the tendons attach into the elbow. Alright, go ahead and straight. And so with all these taping methods, it can be customized, it can be altered in any way that your pain presents. So this is just our standard way of starting. So we will tape you this way and let us know how you feel. Any suggestions like, okay, taped here and it felt good, but then the pain moved. So then that way that your body's letting us know, okay, we took care of one problem, but something else is now getting the spotlight. So we can go ahead and tape for that as well, or treat it that way. So go ahead and move that around. You didn't have really elbow pain per se, but
just from my hyperextension when I was way younger. I know.
Alrighty.
That was 25 years ago.
So that is a very simple way of how we can treat elbow pain. And so this taping here that we have on the inside of the elbow can actually correlate it and flipped over to the other side and fix all of this, which we associate with tennis, with golf, all of that, or tennis and baseball is what I was trying to get at. But
cool.
So we can switch that over, and again, the voodoo floss will help the other side of the elbow as well. So again, if you guys have any questions, or if you feel like this treatment could be something that you're interested in, then go ahead and stop by. We are open from 9 until 1 and 3 until 6, Monday through Thursday. I will be in the office by myself on Fridays and Saturdays from 9 until 1. But anytime that I'm here at the office, I am more than willing to go and do muscle work on you guys. So thank you for tuning in, and we'll see you guys later.
Thank you. I'm going to my room.